Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shalender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you.
Hi guys, this is Dr. Virender Sodhi with your favorite show, Your Body is Your Natural Pharmacy. We make every damn drug on demand. That's my motto here. And that's what I'm going to teach you every day, every second of the year, because our body is a full pharmacy. But then you can ask me what stops us from healing, why we get disease. We get disease because we don't follow the laws of Mother Nature. We did not do what Mother Nature wants us to do, and we get the sicknesses and diseases. And diabetes is one of those disease which is kind of a dreaded disease. But if you really take care of it, you can very easily reverse type 2 diabetes. I'm not talking about type 1 diabetes, but type 2 diabetes can be easily reversed. But I have, many patients who has reversed them, and their A1C, when they came to me, their blood sugar was staying in 400s and 500s, and they were taking all the drugs but still not controlled. Type 1 story is different because you have a insulin producing cells are not there. But even with the insulin type 1 diabetes, we have amazing success with the patients too. I will also discuss with those cases too today. So let's first look at what is diabetes. Diabetes is a metabolic disorder where your body blood sugar is not properly consumed. The sugar is very important nutrient for the body, but that does not mean that we need to have a sugar from outside. Let's look at the Mother Nature. There is no sugar in the form we consume today. Like all your table sugar, all your maple syrup, all your concentrated coconut sugar, that sugar, or even agave, which we think is a natural, does have a little low glycemic index, but that means it does not turn into sugar very quickly, but it does turn into sugar too. And all the artificial sugars, like your NutraSweets and all those things, has not shown that they even help. So interestingly, body converts sugar from when you eat food, and it can make sugar almost from anything, but mainly from carbohydrate. And what is your carbohydrate? Carbohydrate is your breads, your grains, your rice, your quinoa, your amaranth, your buckwheat. Beans does have some carbohydrate too, although they are not as bad for the diabetes, which we'll discuss a little later here. And so basically, first let's look at it. What is diabetes? So what's going on in the diabetic patient? When you eat food, the body converts that food into sugar, and that sugar is then absorbed into your system, and body has a specific threshold. It will take certain amount of sugar, but then if it is not, too much sugar, it will not absorb all of it, and that excessive sugar goes into spillage and keeps circulating in your system, and that's what the diabetes is. And so basically, it is the problem of the insulin sensitivity, especially type 2 diabetes, where the insulin is there, but it's not enough to convert that sugar into glycogen, which is the storage form of sugar. So basically, it's a metabolic disorder where sugar is not properly converted into glycogen and is not stored in our body. How we store glycogen? Glycogen is stored in your liver. Liver is the biggest organ of glycogen storage. And the second is your muscles. So that's why when you people do exercise, they helps improve the blood sugar level, because now you're converting your sugar into muscles and also your liver. And if you look at a lot of people today with the liver, and if you do scan of the liver, you see there is a lot of fatty deposits, which is called fatty non-alcoholic liver disease. They are depositing a lot of fat in that because that sugar is converting to fat, and the liver is not able to process it, and it deposits in it. So majority of people has that situation going on, and this has become a complete hazard to our health. Let's look at some statistics. Right now, almost there are 30 million Americans suffering with diabetes, type 2 diabetes and type 1 diabetes. And even the cases of diabetes in children has gone drastically up. Since 1980, we have been keeping the statistics on diabetes. And since 1980, the disease of diabetes has increased fourfold to fivefold. So in 1980 just was yesterday. It was not too far away. And what's going on? Why we have increased this diabetes so many fold? And we have all the insulins, we have all the oral hypoglycemic drugs, we have all the gliptons and other medications, but these medications are not helping us. We have increased diabetes 4 to 5-fold. In 1980, 5.5 million people were diagnosed with the type 2 diabetes and type 1 diabetes. Now the number is around 30 million. So that comes out to be around 5-fold, almost 5-fold increase in diabetes. So we have to really look at what is going on, why we are having this issue with the diabetes, which has begun, like a wildfire. When I was practicing back in India in 1980, I used to see diabetic patient, but very rarely. Now almost every family has 1 or 2 out of 4 diabetic. So the Indian population has caught up with diabetes, and almost 50% population is getting diabetes. And I see a lot of Indian origin patient here too in my clinic, and a lot of young folks like 30 years old, 35 years old has a pre-diabetic or diabetic condition, and which is not good. And so my question is why we are having this type 2 diabetes becoming a kind of wildfire. I think there are lots of factors to contributing to become this type 2 diabetes. And so let's first look at what's going on with this the diabetes. So diabetes is the 7th leading cause of death, and you can see, wow, that is a strong. And I think with the combined other incidences which it does, because if you have diabetes, your chances of getting heart attack increases manifold, stroke increases manifold. Then you also get a peripheral artery disease where the blood vessels in your legs are kind of scarred up, and that also increases chances of dying. So there is a lot more, and also chances of getting cancer increase when you have diabetes. So I think if you look at the overall effect of diabetes, it's horrendous, it's crazy, and I don't wish anybody to have diabetes. Unfortunately, my mom was a diabetic, and my grandma was a diabetic, and my lots of uncles and aunt in mom's side family has a diabetes. And when I saw that what has happened to my mom, and I decided that I'm not going to go that route. So again, a lot of type, when I see patients, they say, oh, it's genetics because it's in my family. My mother has it, my father has it, I'm going to get it. Yes, you can have weak genes, but you cannot have a diabetes even if you have a weak gene, because if you don't allow your genes to become weaker, you're not going to get the disease. And how you do it is very simple. Again, same principles apply to almost any disease. Eat right, think right, sleep right, do your right amount of exercise, do right amount of stress reduction. Now, it does not matter if you have high cholesterol, diabetes, cancer, high blood pressure, or any other disease. You'll be surprised. Almost every disease becomes normal. So it's not difficult, but I think one of the things which we have done is we have made this society a lot of on the food chain, which has been corrupted, very, very badly corrupted. And that is one of the leading causes, and the stress and the lack of exercise and so on. There's lots of other factors. And so let me first talk to you about the complications of the diabetes. I know I was talking about the different races, and especially we talked about the Indian. In America, around 16% the Asian Americans are getting diabetes. And same number is with the American Indians and Alaskan natives, and Hispanics around 13%. And blacks are another very high diabetics, around 13%. So So you can see that the lot of these uh, traditional races who have lived their lives in a certain way, when they come to this country or they migrate to this country, when they get uprooted from their cultures and their lifestyle, they get diabetes because you change your food habits, you change your exercise habits, you change your cultural background, and that is also a stress factor to become a diabetic. Uh, Diabetes is has a lot of complications. One of the lot of patients who are on drugs with the diabetes, they go into hypoglycemia, and approximately 300,000 emergency visits are done with the low blood sugar because they either got too much insulin or too much drug, and their blood sugar drops down, and it can be dangerous. It can kill you. So folks out there who has diabetes has to be very careful, and I want you to be careful, not medicate yourself. Always take the help of a health practitioner or a doctor who knows what he's doing, and then you can really rest assured that you're taken care of properly. So other complications with the diabetes is hypertension. So what happens is when you're not properly utilizing your blood sugar, that causes the insulin resistance. When you have insulin resistance, your blood pressure goes up. Also, diabetes causes blood sugar dysregulation and also cholesterol dysregulation. Majority of the patient which I see in my clinic has a very reverse picture. Their good cholesterol, which is HDL, are very low, and their LDLs are high, and their total cholesterol and triglycerides, especially triglycerides, are very high. Triglycerides come directly from the consumption of carbohydrate, and so that carbohydrates converts into glycogen, but they are not converting them into glycogen, they are converting into fat, and which is triglycerides, and then they are becoming pre-diabetic and diabetic. When you have diabetes, your chances of getting heart attack increases many fold. So that means you are not helping the whole body there. You're actually making yourself prone to more more heart attack. And similarly, the strokes increases dramatically too, and which is a similar kind of disease of the blood vessels happening in the brain. Diabetes is the number one cause of blindness and eye problems and kidney problem. It's the number one cause of kidney failure, number one cause of eye blindness and kidney failure, and also the amputations. So a lot of people, when they have diabetes and it's not properly controlled, they will get a gangrene or get infection, and then they have to cut that organ there. Usually the digits are lost or lower limbs are lost, to diabetes, because it is causing a blood vessels are destroyed, and that causes the complications like all of these. So why these things are happening? So as I said earlier, that when you eat food, body can make sugar from almost everything, but carbohydrates are the main. So when you are eating this food, your body is converting the sugar into glycogen, and then the sugar which is not converted into glycogen is circulating in your system. When it's circulating in your system, the sugar crystallizes. So that is one of the reason why diabetics has a leg pains and the heel pain. My teacher used to say that when your old shoes start pinching you, you are getting diabetes, because what happened now, the sugar is start crystallizing in your shoe, and all of a sudden your feet become little enlarged, slightly enlarged, because the sugar is crystallizing there, and you are getting the complications with it. Folks, the sugar in your blood vessels, excessive sugar, it works like a ground glass in the blood vessels. So if you take a ground glass and you throw the ground glass in the blood vessels, it destroys the blood vessels. So the excessive sugar will destroy the capillaries, which is the minutest blood vessels in your body. And when you're destroying the capillaries, that's why you have more blindness, you have more kidney disease, you have more heart attacks, you have more strokes and amputation. So if you want to be healthier, you want to control this diabetes. And a lot of people out there, a lot of folks out there are getting pre-diabetic and diabetic. And I will, as we continue our discussion, we'll talk about what you guys can do to help this whole process and what kind of testing you need to do to make sure that you don't have diabetes or not becoming diabetic. So we're going to take a short break here, and we'll come back to the break, and we'll talk about what are the options for you.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So, folks, we are talking about diabetes. So, what is causing diabetes? So, I think there is a lot of factors. If I look at my background, coming from India, my forefathers were all farmers, and they farmed. And when you farm, I'm a gardener myself, and I even till around 10 by 10 land, I'm sweating and huffing and puffing, and I get nice, reward by eating my food and then digesting my food. But most of us are sitting on the chairs, and our food habits have changed and actually has gone worse than before. And so we are not converting that sugar into glycogen, and we are getting the diabetes. That's one of my hypotheses. But other things can be like the food chain has changed. Like a lot of we are eating refined carbohydrates, so white flour. All the fiber has been taken out. All the nutrient has been taken out. White rice. Again, the rice has a special coating on it, and which is has a fiber in it and has a lot of nutrient in it. And those nutrients are very helpful. So we eat white rice. And if you look at a lot of folks, especially the South Indian population, they eat a lot of white rice and they have a lot of diabetes. And so if you can follow that track, you see anybody who's eating white rice, white flour, a lot of sugar loaded foods, they have more diabetes. And if you look at the Hispanic population, again, their diet was different. And then they come to America, their diet changed, and now they have more diabetes. There are Pima Indians who are, there is a lot more diabetes in that culture, in that communities. But the Pima Indians back in Mexico has way less diabetes than the Pima Indians in USA. And so you can see they have obesity and diabetes, but they is so less in Mexico as compared to in America. So there is something wrong what we're doing. And again, our diet has changed because we are not eating enough fruits and vegetables. We are not eating the whole food. The lack of exercise, the stress level has increased. The stress directly causes diabetes because it interferes with your hormones and your epinephrine and cortisol. And these are zittery molecules which changes your balance of delicate hormones. And when you change the balance of hormones, you are going to have diabetes. So there are many factors. And another factor is your drugs. You may not believe that drugs can cause diabetes. Very commonly given drugs like anti-hypertensive drugs, which are called thiazide, which are diuretics, and they have shown to cause diabetes. Another very common drug used for blood pressure is beta blockers. So beta blockers, how they function is they block the beta cells. The classes is like using like a propranolol and all the other classes of metoprolol. Those are all beta blockers. When you use these drugs, they're also blocking beta cells. And one of the biggest beta cell organ is pancreas. So you are blocking the pancreas and you're causing diabetes. in a 6-year study, they found out people who took beta blockers for 6 years, there was a 28% increase in the diabetes. So you can almost 1/3 population got more diabetes. And on one hand, when we give these anti-diabetic drugs, we are trying to, anti-hypertensive drugs, we're trying to protect the heart attack. When you have diabetes, you're increasing heart attack. So you're not overall helping. Another, which is very commonly given drug, is statin drugs for lowering cholesterol. And this will blow your mind off. I've written an article recently, which is got published in the International Journal of Alternative and Complementary Medicine as an editorial. And my heading was, should we stop using statin drugs? Because in a long meta-analysis of different studies have shown that we are not helping any patient. There is not a enough number of patients being helped with the lowering cholesterol, but we have lots of side effects, and one of the biggest side effect is diabetes. Last year there was a study published out of the Finland in the Journal of Endocrinology, where they found out that when people were given statin drugs, there was a 50% increase, guys, 50% increase in diabetes. So you can see that, are we helping the process? Are we making it more worse? And they also found that when people were given statin drugs, the insulin sensitivity decreases. Also, it hampers the production of insulin. So we have a double whammy. So one is the sensitivity is not there of the insulin, and also the production of insulin decreases. So those are not really good for the diabetes. We're going to increase more diabetes. Another very common drug which is used is the steroid. For example, your hydrocortisone, which is very commonly given to even small kids over the counter, and the very common prescription for dermatology, for dermatitis, skin rashes, psoriasis kind of stuff. The also steroids are given for asthma, for ulcerative colitis, for rheumatoid arthritis, almost any inflammation, acute inflammation you have. The steroids are given in a very high dose, like prednisone up to 60, 80 milligrams, then taper down the dose. Some people are taking these drugs for long term. And all these folks out there are going to be prone towards diabetes. So make sure that you are not taking these drugs for long term. They should be used for short and sweet time. And again, if you have a rheumatoid arthritis, if you have a lot of these folks out there, they are on these drugs on a long-term basis. Whenever you get on these drugs for long-term basis, you are going to have diabetes in the long-term basis. Another class of drug, which is called antipsychotic drug, which is used for schizophrenia and other things, has shown to increase the diabetes. And these folks get they gain weight, and they have issues with the insulin sensitivity. Again, I have patients myself and who are put on these drugs, and they have gained and they become pre-diabetic already. Another class of drug which is used is called immunosuppressive agents, and these are given to people who has an organ transplant or people who has a autoimmune disease, and we don't know what to do. And so when you put these people on these the immunosuppressive agent, you also increases chances of getting diabetes many fold. Another class of drug which we call protease inhibitors, which is given for treatment of like AIDS or even cancers. There is an increased incidence of diabetes. So you can see that a lot of drugs, and there is a lots of long list of drugs, almost 300-400 drugs, which causes the diabetes to get more problematic. And so basically we can see that if we are on these drugs, we're going to have to be a lot more careful and conscious. We cannot just make that that these drugs are safer. And my thirst will be to get you off those drugs as soon as possible, because if you're on those, you're certainly going to turn into, on a long-term basis, into a diabetic patient. So basically, you see that we have now a issue with the food chain. We have an issue with the exercise capacity. We have issue with the drugs. A lot of people are popping drugs over the counter, like for example Tylenol. There is no direct link to Tylenol and diabetes, but Tylenol is one of the biggest killer of your liver. And liver is the organ where you store your glycogen. So if you are not helping your liver to get stronger, you are actually not helping the glycogen store. So indirectly, even your Tylenol can not help your liver and the diabetes. Uh, Tylenol is so commonly used for almost headaches to any aches and pains and fevers. Even is given to small kids. And just out there, I want to tell you that Tylenol is the number one cause of liver failure. So if you guys are, fond of taking this Tylenol kind of stuff, avoid it as much as possible. There are lots of things which you can do to help, and especially if you are taking alcohol and you take a on top of you take a Tylenol, you now can put your liver into failure. So this is which you need to watch: the ibuprofen, Tylenol, all those, even aspirin, and you combine with alcohol. And a lot of people they are also taking other drugs on top of it, and then they combine. Now your liver cannot handle all this load, so you have extra amount of stress on your liver. So you can see that constantly we are putting our liver into a strain. And when you're putting liver into strain, which is the storage of glycogen, and we're not able to store glycogen properly, we are going to have problem with insulin sensitivity or resistance. So continuously, we are bombarding our system with these kind of drugs, and not eating proper amount of food, and we are having issues with the insulin storage. So how you can get diagnosed that you have a diabetes? So folks out there, like I have a family history of diabetes. When you have a family history of diabetes, you should start checking your blood test at the age 30, because you don't get diabetes by the age 50 or 40. You start getting it before, and there are signs and symptoms which you need to notice, especially if you have a thirst and you're going to bathroom too often, and you're getting fatigue, and especially sleepy after eating food. Those are all the symptoms which is telling you something is wrong with my blood sugar metabolism. And when you're not properly simulating your blood sugar properly, you can have all those symptoms. So to help that process, what you can do, you can go to your doctor and ask specific testing. And one of the testing which I love a lot is glycosylated hemoglobin, or also called A1C. And what the glycosylated hemoglobin tells us is tells you about your 3-month blood sugar level, how much your blood sugar has been in the last 3 months. Your blood sugar is variable. It changes almost every minute. So that cannot be a good indicator of your blood sugar. But A1C is a good indicator. And the normal levels are less than 6, or 5.7. But when you start creeping up above 5.7, you are going to in the diabetic range. And above 7, people are called as diabetic. So when your blood sugars are staying above 130, you are labeled as diabetic. But you can very well reverse it by taking the natural remedies, which I'm going to talk a little later here. And another thing which I wanted to do is a lipid panel, and especially your triglycerides. And there is a special test which is called the NMR of the lipid particles. So you're looking at how big is your cholesterol molecules are, and that helps you. And also HDL. If you have good amount of HDL, your blood vessels are stronger and you don't have much issues. But if you have a low HDL, which is very common in a Asian population, but what to do for low HDL? The thing is eating good healthy food, exercise, ghee, coconut also increases your good HDL. Looks like we have a caller on the line, and so go ahead. This is Dr. Sodhi. You're on the show Your Body's a Natural Pharmacy. Hello.
Good afternoon. Good afternoon, Dr. Sodhi. This is Alan Neskahi.
Hey, Alan, how you doing?
Oh, I'm doing fine, doctor. Thank you.
That's great. So, will you like to share your story of your journey with your health?
Oh, yes.
Okay, so can you tell me what happened, what brought you to the clinic, and what was going on with you?
In 2005, I discovered I was diagnosed with diabetes.
Uh-huh.
along with high blood pressure, and those two items kind of made me concerned. So that's when it started for me, 2005.
Yeah. So then what happened? What you were given for the treatment?
I was given medication, metformin,
Yeah.
500 milligrams for 1 day,
Yeah.
and that increased to 500 milligrams morning and night,
Yeah.
and then that increased to 1,000 milligrams morning and night.
So your blood sugar was not controlled, but they were going increasing the medication.
No, it was not.
Yeah. Okay. And so you're also given a
Along with
couple
my
of
along along with my high blood pressure also.
yes. And how many blood pressure medication you were on?
I was on high doses of two medications.
Yeah. Okay. So then what happened when you came to our clinic and when was that?
I came to your clinic in 2014.
Okay. And then what happened after that?
My whole outlook on having diabetes changed significantly once I started going to the clinic.
Yeah. So yeah, I know. I remember that we were go on lowering your medication and your blood sugar was improving every time, isn't it?
Yes, it was. I felt better because my blood pressure and my blood sugar was being lowered with
Yeah.
your help, and that gave me a very a more positive outlook on life.
Yes. And so the interesting thing is, because you used to come and you used to get so excited. So my God, my blood sugar is more lower. Your A1C was improving, and we were go on cutting your metformin, and we also cut down your blood pressure medications. And now I think you're still
That's
taking blood
that's
pressure
correct.
medicine, but it's a very low dose, is it?
Yes, sir. Very low dose.
Very low dose, yeah. And but can you share what changes you did to get that improvement in you?
The first change was coming to visit your clinic and
Okay.
learning that my health is in my control through what I do, and so I started taking control of my diet.
Wonderful.
I started taking control of my exercise,
Yes.
and knowing that I can control it through just being more healthy conscious, and is exciting to see my blood result
Yes. Yeah.
change significantly for the better.
Yes, exactly. And Alan, just to show you the research, when you keep your A1C close to the 6 numbers, you don't get any complications of heart attack or kidney failure or eye blindness or amputation. So basically, you can have a long life, disease free, and we don't have to die with the disease. That's what I'm trying to teach people, that we have the control. And I think you have followed that wonderfully. You've been in the with our clinic for the almost 2 years, but you have made a drastic changes in your lifestyle, and even cut down the drugs drastically down, and you're just taking bare minimum drugs, and you have become a wonderful example for many people out there.
Oh, I can feel better as a total individual now. My outlook on life has changed for the better, and I'm just so glad that I was able to learn about your clinic and attend it and get your treatment from you.
Yes. Okay. Okay, Alan, we wish you all the best and keep up the good program because it does not stop here. That means you still have to continue until
Oh,
someday,
oh yes, I.
we we
Oh
would
yes, I
I
know.
think you might have
I
known my favorite phrase. We all go for recycling. Until that day, we all have to function at the utmost best of our abilities, and that comes naturally to us: eating right, proper food, doing your right kind of exercise, sleeping properly, and just be thankful to the Mother Nature what we have been got. What we have been given as a gift, and the gift of health.
yes, sir. Yes, sir.
Okay.
I believe in it, and I also want to say thank you. Your treatment involves a total person, even spiritual, even the spirit of my body is being treated through your care. I just want to say that. Thank you.
Oh, thank you, Alan. Thanks for your nice words and keep up your good work. And thanks for coming on the show. I know it's not easy. A lot of people feel very shy to share their stories, and you're brave out there who is willing to share your story. But I think it helps a lot of people out there who are struggling with the diseases, and they can really can make a big difference in their life. Thank you very much. It looks like we have another caller on the line, and Alan, we're gonna say bye to you, and we're gonna take another call now. Hi, hello, caller. Can you identify yourself? This is Dr. Sodhi.
Hi, Dr. Sodhi. It's Maria.
Hi, Maria. How you doing?
I'm doing great, Doctor. Beautiful day.
Wonderful. So, will you, can you share your story? I think you have been coming to clinic for many, many years now.
Yes, I came to you at least 20 years ago.
Yes.
And I had struggled with my blood pressure since my late 20s.
Yes.
And I was developing other problems, including a high blood sugar.
That's right. And you were in a part of study at University of Washington. They were trying to study the Hispanics who are, has a propensity of getting diabetes. And I think you were kind of a different case for them because you did not show that diabetes sign until now. And I don't want you to go there either. So can you share your story?
Sure. Well, I came to you, and a lot of it was understanding my constitution and how important food was in my life.
Yes.
I was on the standard American diet, eating more processed food and flour and sugar. And so I'll admit it's been a struggle all these 20 years. I'm not perfect, but coming in to seeing you regularly brings me back in if I'm straying too far. And I really try hard to make the changes, the yoga, the breathing exercises, eating in the right amounts of the protein and the carbs. And it's like constantly, there's so many moving parts.
That's right.
That are involved. And, trying to walk after dinner. I mean, you're very consistent in reminding me, are you doing this? And then the supplemental nutrition to help my heart and my kidneys stay healthy have been really, I think I'm doing a lot better than people my age who have converted to diabetes.
Yeah, and the overall thing is that you're still not diabetic, and that is amazingly good 20 years later. And if you look at your results, when you came, your A1C, your blood sugar A1C levels were high, and that's a dropped, and consistently dropped and within comfortable normal limits. So, which is amazing stuff what you have achieved for yourself. And again, Maria, I think it's a wonderful work you've done, and it's an ongoing thing. It's like I tell my patients, it's like your job. If you don't go to your job, you don't have a job. You cannot just pop in a pill or a supplement or a herb and expect that it's gonna, just fix everything. No. Do you have anything to tell our listener that how you achieved it? And yes, you said you're not perfect, and I don't think I'm either perfect either. But if you stay, what I tell my patient, if you stay on top of a road, you're on road. But if you get off the road and then try to get back on road again. So what do you have to say?
Well, I always try to keep ahead of what's like I eat healthy, make good choices. I read labels. I keep up with the new research, like on fats, how different we used to think about eating fats. Now fat is good for us with the right kinds of fats.
Exactly.
it's always about learning and growing more and, finding a way to enjoy physical movement, go to the club I like or do the activities I like, staying active. I mean, it's all part of your health, and nothing feels better than being healthy.
Exactly. Yeah, so it's really amazing, what you have achieved, and you have warded off yourself from the diabetes, and you have a strong family history of the diabetes, and I think congratulations on that, and keep working on it. It's not done yet. It's just you have a constant work in front of you, which you have to keep working on it. And I really want to thank you, Maria, again coming on the line, and this is amazing, and what you have achieved, and thanks for coming and encouraging other patients too. So looks like there is another caller on the line. Caller, can you go ahead, please? Hello.
Hello.
Yes, you're on line. Yes.
Hi, it's Prithvi. So
yes.
My question is, how do you so Diwali and Halloween are on the same weekend. So how do I have both the Indian sweet and the Halloween sweet without getting diabetes?
Okay, that's a very sweet question, by the way. I think you're so sweet. I don't think you're gonna get diabetes, so don't worry. But if one thing is, I think the festivals are there to enjoy, and I'm not against using little bit sweets here and there. But the problem comes when we overindulge ourselves. So if you have a Halloween candy, and if you enjoy one candy, I'll be fine. It'll be perfectly okay. And same thing with the Indian sweet. But if you overindulge yourself, then you're going to get, and you also set a wrong pattern, wrong kind of habit in your body. The sugar is very addictive, by the way. When you start eating sugar, like I love sugar myself, by the way, so I have a confession to be made here. And I think a lot of people out there, they just love sugar. And but what I see in myself, when I start eating sugar, I want it again and again and again. So you can enjoy your Halloween candy, but one a day, or you can have a one sweet. So you cannot have combined together your Indian sweet and a Halloween. On the day you want to use your Halloween candy, use that one, or you can use a Diwali sweet. So if you do that, you should be perfectly okay. But also, you have to add more green vegetables. Eat your greens. You eat more carrots. You eat more spinach. You eat more mustard, more vegetables, more beans. That will also help you. And you also have to add nuts and seeds. Like you can have almonds and pecans and walnuts. Actually, I was going to tell you that, but you asked this question. But this is, wonderful. And how old are you, Prithvi?
I am 9.
9 years old. Okay, that's a wonderful question from a 9 years old, and I think you deserve a big applause for asking that kind of question. And but Prithvi is learning good habits, and the sweets are not the worst thing in the world, but if you use it in moderation. Like I allow my patients to have 2 teaspoons of honey. That is the only natural sugar in the Mother Nature. Every other sugar we have made. For example, sugar cane we made, maple syrup we have made. So that if up to 2 teaspoons of any sugar will be fine per day, but that is for the whole day. Even my diabetic patients get that allowance. They can have 2 teaspoons of honey a day, and surprisingly, they don't get their blood sugar very high. So again, the moderation and avoiding indulgence and making a full range of food in your daily life, putting lots of green vegetables. And we are going to talk about, how you can balance your blood sugar after we come after the break. And we will continue our discussion on diabetes. And thanks, Prithvi, for calling.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
So, the question from Prithvi was very wonderful. How we can avoid with the Halloween and the Diwali coming very close to each other and excessive sugar. I remember when my kids were young, and they just love for trick and treat, and they used to go and they will collect almost a full guinea bag of the candies, and so I remember as a when they were young, one day I said, I'm gonna take your candies and I'm gonna ration that to you, and my both kids were so upset at me because this was their hard earned candies, and I have to look at the faces. They were just actually almost wanted to yell at me. They did not, but I think maybe out of respect or what, but they didn't like that. And but the advantage was that they did not get any cavities. They did not have any sugar addiction patterns. And so we used to take those candies and we would just give them, okay, one or two a day, and help them not to overindulge in this kind of sugar habit. And because it's a habitual, once you become habitual of eating sugar, you go on eating, and it is a really, really bad habit. Looks like there is another caller. Go ahead, caller.
Hi, good afternoon, Dr. Sodhi. This is Ajay.
Hi, Ajay. How are you doing?
Doing fine, Dr. Sodhi. First of all, thank you for conducting this wonderful program, and would like to make a comment and maybe share my story. First thing you said was like people are very shy, that they don't want to go to a doctor, or they don't want to share really that they are going through the spikes of the blood sugar, which is
That's
very
right.
true.
Yeah.
And definitely the first thing is actually taking it out and then talking to the doctors, as I started talking to you, and then you started recommending me a lifestyle change and all those things. And that really helped me well. So I just wanted to, share the same story, that when I came to you, it was like pretty high in like
Yes.
10 or 11 range. And then, I think it's almost like a year. Now it's
Yes.
dropped down to 6 with all
That's
the
right.
lifestyle changes and all the, medicines that you're giving me. And it's been a wonderful change so far.
Yes, Ajay. Thanks for again. Ajay, I think one thing was I was very mad when I saw your results, because I said, my God, this young boy is not listening to his body. And you had this blood sugar going crazy in you, and you worked like a dog almost. I'm sorry to say that, but you just worked and did not pay any attention to your body, and that is the side effects which you're going to have. And you're not looking at the food, you're not exercising properly, and now when you put all those parameters back into the your body back again, you have perfect balance, and you're achieving the normal blood sugars too. So can you, what was the most difficult thing for you to do?
I think the most difficult thing was, as you've been saying, that, okay, sugar is addictive, and definitely eating bad food or eating the non-standard food is a very easy choice. So making a lifestyle change, basically, and, sticking to the regimen of what you told me, what to eat, how to eat, and, how to go about start your day, doing the exercise and all those things, that really helped. Medicine, slowly it'll come down, as I started with you pretty much the same thing, like 2000 mg of metformin, and then on top of that also blood sugar controlling medicines. But now I'm just on metformin, and that all happened because of the lifestyle changes that you have chalked out specifically. That, okay, you need to eat this, and follow this style. I'm a vegetarian, so for me it's easier and tough at the same time. But yes, as you know, the Asians, we love eating greasy foods and eating samosas and all those things outside. But I think with your strict instructions, that if you eat it, you will see the results, and that exactly happened the way we were anticipating. And I'm glad, I talked to you a year before, and here I am a year after. It's like exactly my sugar is staying 6 and below the 6, and I'm very happy about that.
Thank you, Ajay, for sharing your story. And, I think you guys have been wonderful inspiration for the rest of the people. And again, as I said to other callers, This is a continuum process. You cannot stop it here. You need to continue. And I think the gift of health is a wonderful thing for all of us. When we're healthier, we can achieve a world. And the millions of dollars in your bank will not give you a single ounce of health, but a single ounce of health can give you millions of dollars in your mental and emotional satisfaction. So I'm gonna wrap up, because we're running out of the time here. There are only a few minutes left, and I wanted to tell what they can do to help this whole diabetes process. So basically, the first thing is your food. First thing is your thought process. So one thing is you want to be healthy. If you don't want to be healthy, nobody in the world can make you healthy. Drugs don't make you healthy. Supplements don't make you healthy. What makes you healthy is your thought process, your food, your activity. And activity, when I talk about activity, the exercise is fourfold in my perspective there. One is your aerobic kind of activity, like walking. I don't like people to run. Running is not the best for people because they're going to lose their knees and hips in the long-term basis. I'm not talking short-term. But interval walking is the best way of getting your system into shape. Strength training is basically phenomenally good doing lightweight exercises because remember we talked about glycogen. When you do weight training, you are storing your glycogen into your muscle, and that becomes a good warehouse. And then yoga is for flexibility, for stretchability, and meditation, calming your mind. If you have a calm mind, you're going to be much more better. Again, food is very, very important. And most of the Asian population out there, they eat a lot of carbohydrate and rice and rotis and wheat and pastas and type of stuff. That is not going to be the best food for them. They have to cut down their carbohydrate. And I see a lot of South Indian patients and I see a lot of North Indian patients. And when I tell my South Indian patient cut down the rice, they get very angry with me. When I tell my North Indian, Punjabi especially, cut down your roti, they get very mad at me too. So because, they have been told this is so good for you. That was good for you when you were a farmer. You're working very hard. When you're sitting on the chair, it's not good food for you. So cut down your carbohydrate, increase your beans if you're vegetarian, increase your nuts and seeds if you're vegetarian. And again, if you're not a vegetarian, you can add chicken and fish and meat, but not too excessive because excessive meat is not good either. There is a balance. What you can add excessively is the vegetables. And I tell my patient to eat 4 to 5 servings of green vegetables every day. Good fruits are very important. And again, whenever you're eating fruits and vegetables, try to look at the seasons. Right now, pomegranates are in season, persimmons are in season, apples are in season. Those are really good for you. And, but only 2 fruits. Even a diabetic patient can have 2 fruits a day. It does not increase your blood sugar. Most of the fruits has a low glycemic index unless you make a juices. I don't recommend juices at all, except for one juice, pomegranate juice. You need to have good oils in your food. You need to have around 1 to 2 tablespoons of oils a day. Add spices like cinnamon, amazing spice for diabetes. Turmeric, garlic, ginger, fennel, dill seed, leeks. Almost every spice has a beautiful effect on you. And there are lots of supplements which you can take too. And one of my favorite is zinc, chromium, bitter melon, Gymnema sylvester, Pterocarpus marsupium, holy basil, neem. So all these things will help you, but if you want to help yourself. So in the nutshell, you are your body's pharmacy. Look at what you put in your body. Have a right kind of thought process. Do right kind of exercise, not too excessive, not too little. And get yourself checked out. You can go to your doctor. You should at least, every one of you should have yearly checkup. And especially the Asian population and a lot of diabetes out there, a lot of heart attack. And once you do that, I think you'll be on a long haul and you will get wonderfully healthy and you stay healthy. And when you're healthy, your family is healthy and you have a wonderful relationship with your family and the rest of the world. So keep enjoying your festivals coming in. Diwali is coming and Halloween's and all of that. And have a wonderful time until next week.